By 20 years of diabetes, almost 75% of the people develop some form of diabetic retinopathy. The risk factor is hypertension. Smoking. Smoking is a very bad risk factor. If you already have diabetes, this smoking causes the arteries to be stiff, what we call as arteriosclerosis. Hello everyone, welcome to the Retina Connect. Last video we looked at what is diabetic retinopathy. So let us look at what are the risk factors for developing diabetic retinopathy. So the most important risk factor is the duration of diabetes. So what it means that is, when a person develops diabetes, he doesn't have retinopathy. Over the time, usually after 5 years of diabetes, they start having diabetic retinopathy, the earliest stages. And as the time goes, like 15 years, the risk of developing diabetic retinopathy is 6 times more. By 20 years of diabetes, almost 75% of the people develop some form of diabetic retinopathy. However, this duration of diabetes is not modifiable. Whereas the most important risk factor, which is modifiable, is the hyperglycemia. That means that the high sugar levels for a prolonged time weakens the retina. So that can be controlled. For example, there's a huge difference between a person whose glycosylated hemoglobin levels are above 10 and a person who is maintaining his glycosylated hemoglobin at 7. So he may not develop diabetic retinopathy even till 10 or 15 years. So that's the importance of having a good glycemic control. Now, another risk factor is hypertension. So it's important to have your blood pressure under control so that the onset as well as the progression to severe stage of diabetic retinopathy can be controlled to an extent. Hyperlipidemia or high cholesterol levels needs to be controlled because the hard exudates or cholesterol deposits in the macula or the retina is more in such people. Again, a risk factor for vision-threatening diabetic retinopathy. And people usually having diabetes having a nephropathy, the kidney problem, the elevated creatinine, microalbuminuria and anemia or low hemoglobin, all this can worsen the diabetic retinopathy. So these are all the comorbidity conditions that people can have that can affect the onset or progression of diabetic retinopathy. Now, other risk factors like smoking. Smoking is a very bad risk factor if you already have diabetes, and these tiny blood vessels, what we call as microangiopathy. So that is the main problem in diabetic retinopathy. This smoking causes the arteries to be stiff, what we call as arteriosclerosis. So in them, the diabetic retinopathy progression will be faster, so they have to quit immediately. And the other risk factors like pregnancy can worsen the diabetic retinopathy, so needs care for diabetic retinopathy during that time. And even obesity, it's a lifestyle now, it's very rampant. That also can worsen the diabetic retinopathy progression. So I hope it's clear regarding what are the things we look for as risk factors. And thank you for watching this video.